Yeah, systems medicine for network pharmacology and drug repurposing. What's currently happening in medicine is considered a Kondratiev wave. So, Kondratiev waves have been the major socio-economic revolutions in our society. So, it's not just another innovation. So, for instance, the invention of the steam engine allowed the industrial revolution. And, for instance, electricity, the invention of an electric light bulb was not an incremental improvement of a candle, it was something completely new. So all characteristics of these Kondratiev waves are, first of all, they take about 40 years, so 2 generations, and they are usually in response to a crisis. And I think we all agree that the most recent Kondratiev wave, the 5th one, was the IT revolution. But we are now at the end of it. We have our Googles, Amazons, Apples, and so forth. And the question is, what is the next big thing? It's probably not going to be Industry 4.0. That's the same old thing, just digitalized. And it's probably also not the renewable energies, because those technologies are there since decades, but politicians are too late to actually implement it. But they are there, and it's just another energy form. So a lot of futurologists think the next big thing, the 6th wave, is a complete redefinition of psychosocial health. How we define health, how we cure patients, and most importantly, how we prevent disease. But as I said, these waves always start with a crisis. And then sometimes I hear, what's the crisis in medicine? We have such a perfect medical system. So it's very important to understand, to begin with, what is the crisis in medicine? Why is there a crisis? So one thing you might think of, well, mortality has increased so much since 1900. So medicine has achieved something. Yes, that's indeed the case. This year is the Spanish flu, a little peak. But if you look, what was the contribution to this reduction in mortality by preventing or treating infections? So hygiene, vaccination, and antibiotics. That's the red curve. And now subtract the red curve from the black curve. This is what the rest of medicine has achieved since 1900. I'm a pharmacologist, and this is also about pharmacogenomics here. So these were in 2015, but in principle it's the same thing still, the most selling drugs in the US. And the green patients are those that will benefit from those drugs. The red patients are those who will also receive those drugs. And we know they will not benefit from them. And that's not a conspiracy theory, that is the number needed to treat. You can get it from every phase 3 trial. How many patients do I need to treat with one drug so that one patient has a benefit? And that's in precision medicine, I would say. The consequence for the pharmaceutical industry has been, you may all know that in the 80s, 90s, there has been an exponential increase in investments in drug discovery and development, which is now leveling off at an absurdly high level. But despite this increase in costs, the new medical entities, that's the green line, that have entered the market is more or less the same. So if the costs have exploded in the industry and the outcome is the same, the industry has a problem. But that's not a recent problem. This shows how many drugs can you get onto the market per $1 billion spent. So in the 50s, these were about 20, 30 drugs. Since then, there is a constant decline in the efficacy of the pharmaceutical industry. Now, here's the line, now you don't get even one drug per $1 billion spent. Depending on the year, it costs $2.3 to $5.8 billion to bring one drug successfully to the market. And this is a logarithmic scale. So, and that was not due to tighter regulations post-thalidomide. It has also not improved with the introduction of biologicals. It is leveling off probably through the introduction of genetic medicine. But obviously, there is something conceptually wrong how we define diseases and how we define drugs. There were low-hanging fruits in the 50s, 60s, but they're no longer there. Doesn't work anymore. And even those drugs that make it to the market, beyond phase 3, there's a study from the German regulators that 2/3 of the drugs that showed a benefit in a phase 3 trial and were then approved, later, when they tested in real-world patients, so not hand-picked, no comorbidity, optimal age, but normal patients, nothing of this benefit remains. 2/3 of all newly approved drugs have no benefit over standard of care. All these failures have resulted that the pharmaceutical industry has almost retracted from all indications. So this shows all medical indications, and the height of the bars show how many drugs have been approved in this area of medicine in 5-year blocks. And red are the most recent developments. So you see there is not a lot of red on this. Let's zoom in down here. So pharma is in the moment mainly focusing on cancer drugs. You can still get a cancer drug always onto the market. Immunomodulating drugs and antivirals, hepatitis C and so forth. Everywhere else, there is more or less silence in innovation. There are lots of things that are going wrong, also in academic research. I don't want to waste your time with that, but the most profound problem that we have is that we hardly understand any disease. What usually happens, the patient just goes for a checkup to a doctor. He or she thinks, I'm healthy, and then the doctor measures your blood pressure is high, your cholesterol is high, your blood glucose is high, and so forth. Or they come with a symptom to the doctor, I can't breathe so well anymore, and so forth. And then the disease is named after the symptom in the organ. Heart failure, inflammatory bowel disease, asthma, hypertension. What is this? These are not molecular disease definitions. These are descriptions of symptoms in organs. There is no molecular understanding of the cause of the disease. And if you don't know the cause, you can't repair it. And if you can't repair it, it's chronically defective. So that's why we have so many chronic diseases. A chronic or a complex disease is a capitulation of the current medicine. We don't understand it, we can't cure it, we can treat it a little bit, but that's it. And of course, in such a knowledge base, it's very difficult to be better than the Beatles. The CEO from Novartis once said, pharma companies that only treat and don't heal will disappear. So we have to start healing disease and not just chronically treat. In the moment, our healthcare system is it's a sick care system actually. It's geared to treat diseases. The ideal patient is chronically sick, every 3 months gets his new pills and doesn't die. That's the optimal patient. The whole system is geared towards that type of patient. The biggest mistake that we have done in medicine, understandable, I'm not accusing scientists, fellow scientists, or clinicians of doing something voluntarily bad. But we have divided the whole body, organ by organ, and we think by just looking at one organ, we can understand the disease. And if the patient has any other symptom in any other organ, it's another disease, let this specialist deal with that disease. Or if I'm a researcher in cardiovascular, I don't want to hear about brain diseases and GI diseases, I work on cardiovascular. So we have neurology, neurologists, neuroscience. We have cardiology, cardiologists, cardiovascular research. Or we name diseases after doctors. Alzheimer, Parkinson, super disease definitions.